Hello and welcome. Today we'll be exploring a complex autoimmune disease called systemic sclerosis, also known as scleroderma. It's a condition that affects the connective tissue, leading to thickening and hardening of the skin and internal organs. Join us as we delve into its causes, symptoms, diagnosis, and treatment. The exact cause of systemic sclerosis remains a mystery, but scientists believe it's a combination of genetic predisposition and environmental triggers. It's not directly inherited, but individuals with a family history of autoimmune diseases may have a slightly higher risk. Potential environmental factors under investigation include exposure to certain chemicals, viruses, and even some medications. However, it's important to remember that none of these have been definitively proven as direct causes. Systemic sclerosis is characterized by three main processes: inflammation, vasculopathy, meaning damage to small blood vessels, and fibrosis, which is excessive collagen production leading to tissue hardening. Initially, the immune system mistakenly attacks the body's own tissues, causing inflammation. This inflammation damages the small blood vessels, further contributing to the problem. The damaged blood vessels then release substances that stimulate fibroblasts, the cells responsible for producing collagen. In systemic sclerosis, these fibroblasts go into overdrive, producing excessive amounts of collagen. This excess collagen accumulates in the skin and internal organs, causing them to thicken and harden, impairing their function. Systemic sclerosis is a relatively rare disease, affecting approximately 50 to 300 people per million worldwide. It is more common in women than men, typically affecting individuals between the ages of 30 and 50. While it can occur in people of all ethnic backgrounds, it is observed more frequently in African Americans than Caucasians. Understanding the epidemiology helps researchers identify potential risk factors and develop more targeted prevention strategies. The signs and symptoms of systemic sclerosis can vary greatly from person to person, depending on the extent and location of the organ involvement. Early symptoms often include Raynaud's phenomenon, where the fingers and toes turn white or blue in response to cold or stress. Skin thickening, particularly in the fingers and hands, is another hallmark symptom. Other common symptoms include fatigue, joint pain, mucositis, heartburn, difficulty swallowing, and shortness of breath. In more severe cases, systemic sclerosis can affect the lungs, heart, kidneys, and digestive system, leading to serious complications. It's important to recognize that not everyone experiences all of these symptoms, and the severity can vary significantly. Diagnosing systemic sclerosis can be challenging because the symptoms can mimic other conditions. A doctor will typically start with a thorough physical exam and review of the patient's medical history. Blood tests are crucial to look for specific antibodies, such as anti-centromere antibodies and anti-cell-70 antibodies, which are commonly found in people with systemic sclerosis. Other blood tests can assess for inflammation and organ function. A skin biopsy may be performed to examine the skin tissue under a microscope. Additional tests, such as pulmonary function tests, echocardiograms, and gastrointestinal studies, may be necessary to assess the involvement of specific organs. Systemic sclerosis is often classified into subtypes based on the extent of skin involvement. Limited cutaneous systemic sclerosis typically affects the skin of the fingers, hands, face, and forearms. Diffuse cutaneous systemic sclerosis involves more widespread skin thickening, including the trunk and upper arms. Scleroderma sign scleroderma is a rare form where internal organ involvement occurs without any noticeable skin thickening. Overlap syndrome refers to individuals who have features of both systemic sclerosis and another autoimmune disease, such as lupus or rheumatoid arthritis. This classification helps guide treatment decisions and predict the potential course of the disease. There is currently no cure for systemic sclerosis, but treatments are available to manage symptoms and slow the progression of the disease. Treatment strategies are tailored to the individual's specific symptoms and organ involvement. Medications commonly used include immunosuppressants to suppress the overactive immune system, vasodilators to improve blood flow, and medications to treat specific organ complications, such as lung fibrosis or kidney disease. Physical therapy and occupational therapy can help maintain mobility and function. Lifestyle modifications, such as avoiding smoking, protecting the skin from the cold, and eating a healthy diet, can also play a crucial role in managing the disease. Regular monitoring and follow-up with a rheumatologist and other specialists are essential to ensure optimal management. Because the exact cause of systemic sclerosis is unknown, there is no definitive way to prevent it. However, minimizing exposure to potential environmental triggers, such as silica dust and certain organic solvents, may reduce the risk. Avoiding smoking is also crucial, as it can worsen the symptoms and complications of the disease. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can help support overall immune function and potentially reduce the risk of developing autoimmune diseases. The prognosis of systemic sclerosis varies greatly depending on the extent and severity of organ involvement. Some individuals may experience a relatively mild course of the disease with minimal impact on their quality of life, while others may develop more severe complications that can affect their lifespan. Recent research has focused on identifying new biomarkers to predict disease progression and developing more targeted therapies to slow the progression of fibrosis and improve organ function. Clinical trials are ongoing to evaluate the effectiveness of new medications, including antifibrotic agents and stem cell transplantation. These advancements offer hope for improved outcomes and a better quality of life for individuals living with systemic sclerosis.